We've seen a growth in many areas of community-based care, case management, more preventative care, crisis mobile teams, that sort of thing, which has really changed the landscape of our services and has led us to a point where we can make very significant changes, like closing an institution that had existed on the county grounds since the 1880s.
This has been a process and an evolution to change the whole model within the Behavioral Health Division. And quite frankly, the county is not in the business to run a hospital and can't financially afford to do that. The redesign process has been about getting input from the community. It's been about getting input from providers. It's about getting input from different organizations, different stakeholders, the Milwaukee Mental Health Task Force.
It was very important for us to include feedback from the people that we serve, the people who actually utilize the services delivered through the Behavioral Health Division in our partnerships. And so often such decisions are made without any feedback or participation from people served. So it was really crucial for us to make sure we were hearing from people who had experienced our services, who had knowledge of the system, and could tell us where we were good and where we weren't so good. And so the only way to do that is to really get out there in the community and ask people what they think. We wanted to make sure that we structured it in a way that we got feedback from all of those stakeholder groups and really could weigh all those opinions and experiences as we moved forward to the establishment of a mental health crisis center, but also really the whole continuum of care. We heard very consistently that access to services, both the physical location of those services and really understanding about how and where to get help, those are the things that we heard the most about.
We know that there are 7 zip codes in the city that are the primary users of crisis services. So the new emergency center will be located on 12th and Walnut.
We're talking about a system that is very complex. Our health systems are complex. Our mental health systems are even more complex. And it's real easy for people to slip through the cracks or to miss the nuance of diverse communities, cultural nuances, economic nuances, subtleties, anecdotes. And so having the community richly involved helps the Mental Health Board, BHD, to provide a robust set of services that are responsive to the genuine needs of the community.
Having community conversations is essential, not just to plan for the transition, but as an ongoing practice to make sure that we have strong understanding across systems, strong community buy-in and support.
I think it was successful because we did it. There was input, and I think that it was a nice turnout. But I think we can do more because I think there needs to be more of that.
Universal Health Services will have a freestanding 120-bed mental health facility where they will provide behavioral health services for adolescents, adults, and the older adult populations in Milwaukee County. You're coming for maybe a mental health concern, but is there a housing need? Is there transportation? Can we get you connected to services? You need a birth certificate from the court, right? So it's meeting people where they are, finding out what those underlying needs are, and getting them connected so they can be their healthiest selves.
No matter where you come into the system, everybody should be equipped to help you and to make those connections, so you're not left to say, well, we'll help you with this one thing, but you have to go here and here and here to get the rest of your needs met.
And the big piece, the most important piece as we see in there, is the connection with those community services. That's what No Wrong Door is.
We definitely need people to provide input at the board meetings where there is opportunity for community input.
Everything we do is a public record, a public document. The mental health board meetings are open to the public. We do a number of public listening sessions throughout the year where people have the opportunity to speak and tell us what they would like to see happen.
The input that we received, it was valuable in how we identify how do we move forward and how do we make sure the people that we serve, they're at the table. We hear their voice. They are helping us to make the decisions to say, this is what you need, and it's not the county is saying what you need.
As a mental health board and the behavioral health division, we're committed to providing services that are good for the community and good for people.